Well, hello and welcome. Well, today I would like to talk about a product which we have developed for our business clients before the outbreak of the pandemic. It was launched early this year. We called it Healthy Company, and it provides a complex approach to employee health. This is important because nowadays health, when you look at Okay, I just wonder if I'm able to change slide. Okay, if we look at the definition of, can we go back one slide? Okay. If we look at definition of health by WHO, it goes beyond medicine to encompass other areas that impact our health, our physical activity, diet, mental health. Extremely important. My colleagues from LuxMed Group have just highlighted it. It's especially important in times of pandemic. But interestingly, this is another element which is very well fit for e-health. So our Healthy Company package addresses employees and employers' needs who want to take care of their health, who want to maintain good mental and physical health of employees, especially now. And as it transpires, application of this tool has been made difficult by the epidemic, as it is not possible to provide certain physical services. So we were faced with the need to apply those solutions online, transform them into e-solutions, and we have been developing telemedical services for 14 years, and we have vast experience in this area and in other areas. We have to shift to new solutions very quickly, and this is what we did, and I'm going to discuss it today. Healthcare. For many years, we've been using different communication channels, including chats, email, and phone. We have also implemented solutions last year, such as e-prescription, e-referral, to make life easier for the patient. And obviously, to support employers, we have implemented a number of solutions that may be delivered remotely. Our e-member platform supports referral of employees for labor medicine tests. You don't need physical contact to get the referral. And as a result, we have found our bearings very quickly in March, when most of our services were delivered remotely. And of course, the scale and the range of telemedical services has grown exponentially, so we had to focus on growth. Today, remote consultations account for 53% of all consultations delivered by our healthcare professionals, but we were ready. In other areas, there was certain innovations, for example, prevention. Most activities were delivered during one-on-one contacts with our patients, clients, customers, but many solutions that were moved online were very well received by our clients, our patients. For example, webinars on backache, which is a very frequent symptom in offices, has met with enormous interest. And we have even noticed that the attendance and participation rate at such webinars is fourfold higher than during standard classroom training events. So it met with approval of employees and employers, and those online training sessions are more popular than standard sessions. We even delivered e-workshops in first aid And despite some problems, they were delivered very successfully. Sport, well, it seemed that sports would pose the biggest challenge, because when you think sport, you see physical activity in real life, and this is how it should be. Well, until recently, we were offering gym, swimming pool, etc. All those facilities were shut down. So very quickly we have launched an online platform with workout routines to be used remotely by our clients. And together with our partners, we were offering live workouts, live sessions. Our clients could connect with our platform via smartphone or TV and follow instructions of the trainer who was explaining how to perform certain activities. So 13,000 people benefited from those sessions. And as you can see, we have found a way to follow up on physical activity during lockdown, what met with enormous interest of our clients. So even sports went online. What helped us enormously to provide continuous services to our customers. Medicover dietary solutions. Well, it turned out that in a rather simple way, we can get online. Why? Because our how-to books were available online. Most webinars on dietary regimes were delivered remotely. We have created a platform well in advance, so a large chunk of solutions was ready. But what was new and began to work very effectively, we had a hotline. We had dietitians answering phones. Before that, they had one-on-one meetings, and we moved all those meetings to the online universe. They were also answering phone calls. And like previous speakers, I want to stress that early on we had certain doubts voiced by our customers, by employers who weren't sure will such format work. But very soon we were reassured, because online services, online consultations were very popular and well received. In many cases, direct interactions are not required. Of course, not always, because there are cases when in order to have the diagnosis, you need to have your blood tested. For example, a dietitian who is working on your diet will require a number of tests to be performed, but you can be tested later, share your test results with the dietitian, and during a remote consultation get your dietary solutions or dietary regime. Well, the next area we have moved online are benefits, Medicover benefits. These are solutions that focus on our spiritual life, on our interpersonal interactions, to take a break from the mundane reality. So I'm talking about work-life balance, for example, going to the movies, going to the theater. And again, it was a major challenge in the heels of pandemic when theaters and movies were shut down. So we had to move solutions to the online universe to enable our customers to access different virtual platforms where, for example, language courses were available, or e-book stores, or platforms, or streaming platforms. So we see massive growth in this area. Major interest was generated. Our customers were very interested in the offering of sports stores, because very often, like I've said, to take part in virtual workout, customers had to purchase a sporting gear. So this translated into shopping on our platform. And Allegro and Morella turnover went up by 30%. And another area we have just discussed, mental health. What we notice in this area is much bigger interest, perhaps born out of needs triggered by COVID pandemic, because regrettably demand for mental health services has gone up. Very often there are anxiety issues. We are anxious about the future, about what the future holds for us. So we definitely see a massive surge in demand, and we see increased approval for e-consultations in this area. To be honest, I believe that it's a very intimate area, and many people who were anxious before to visit our clinics, not to bump into friends or acquaintances, being online means being anonymous, so it's safe, it's private, and each and every patient feels comfortable during telephone or remote consultation. So Madrid has gone up in webinars tackling stress management, which is very relevant today. Stress levels are high, and employers, in order to take care of their employees, are very often consulting us on stress management. So mental health is definitely one of the areas which benefits from the crisis. And sometimes crisis situations are able to ignite additional motivation, and I think our offer has grown as a result of the pandemic. So the Healthy Company offer consists of 6 interconnected elements. It's geared for the times when all those services are no longer available in the real world. We had to go online. We were forced by circumstances to modify some solutions to make them fit to the situation, and we've managed to do that in no time. And in many areas, we see that online solutions or remote or electronic solutions are even better received by customers, by employers and employees, and our patients than traditional and conventional solutions. So I think it was an opportunity for us to modify our range, and we are very happy that it met with such enthusiastic reception of our customers. We also believe that most remote solutions will stay with us for good, that current circumstances have got us used or forced us to learn, handle virtual solutions, which we previously shied away from. I'll compare the medical sector or transformations in the medical sector to what was happening several years ago in the finance sector. Well, I remember the times where you would visit the bank with your checkbook. When I'm telling it to my children, they don't believe me, because they know very well that you don't need to take out money, because a piece of plastic will do, and you get money from the wall. So solutions we are implementing today, electronic solutions in healthcare, will stay with us, most of them, and patient and customer behavior will be evolving. Thank you very much.